we're going to complete the thorax and lung exam. First, I'm going to ask you some questions. Sir, have you had any shortness of breath at rest recently?
No.
Have you had any shortness of breath with exertion?
No.
Have you had any non-productive or productive coughs?
No.
Okay, to begin the thorax and lung exam, we're going to do an overview and inspection of the chest. We're looking for pectus excavatum, which is the protrusion of the sternum, or we're looking for pectus carinatum, which is the sunken chest appearance. We're looking for the respiratory rate to be equal and even. We're looking for easy and equal chest rise and fall that is also symmetric. We're going to palpate the chest, feeling for any abnormalities or masses. And none were noted. We're going to auscultate the chest. When I place my stethoscope, if you'll take a deep breath. So he had clear breath sounds bilaterally. They were primarily vesicular sounds. He had no adventitious breath sounds such as rails or wheezes that were noted. Finally, for the front of the chest, the anterior of the chest, we're going to do some percussion. So we're going to stay over the lung fields. We should hear resonance, which is a very dull sound. If we're going to hear resonance, which is a very hollow sound. If we happen to be over bone, you'll hear a very flat sound. Or if we're over any sort of masses or any organ such as the liver, we'll hear a very dull sound as well. So resonance was noted there, and if you would turn around for me. So as we begin the posterior thorax, the first thing that we're going to look for as we're going to inspect side to side again, making sure that the respiratory rate is equal, easy, and unlabored, that the chest rises and falls equally and symmetrically. We can place our hands here to feel that the rib cage is expanding symmetrically. We'll take a note of the transverse AP diameter. It should be 1 to 2. If we note a 1 to 1 diameter, that would give our patient a more rounded appearance, and they would have a barrel chest appearance, which we do not see here. We're also going to inspect the spine. We want it to be in an inline position. We don't want to see any scoliosis, which would be the S-word shape of the spine, or kyphosis, which would be that abnormal humpback shape, which again we don't see here as well. So we inspected it. We're going to palpate again. We're going to feel for any abnormalities or masses that may be noted. None are noted here. We'll again auscultate when I place my stethoscope. If you'll please take a deep breath. We'll stay over the lung fields. And again, we'll also make sure that we listen laterally. Okay, again, the lungs were clear. There were no adventitious sounds here. He had clear lung sounds in all lung fields. And then finally, we're going to percuss. Again, listening for that resonant sound, that very hollow sound. And that's the end of the lung and thorax exam.